Hi guys. Today is my first, I guess, official story time video, and I know if you're not interested in this story, go ahead and just click out. Or if you're gonna be like obnoxious or like annoyed because you're like, girl, we've like whatever, yeah. This is for those of you who are curious as to what happened to my hand, what's going on, because I posted on Facebook and I've got a lot of messages and a few comments of like, what happened, are you okay, like what's going on. And this is just one easy way to tell everybody, have it all out in one thing, and yeah, just have it open. And I did say that I was going to mention it in a video, and I think because there's a lot to go over, I just decided to make its own dedicated video. So yeah, that's what's going on. So subscribe to my channel if you aren't already, and let's go ahead and get into this. I'm sure it's going to be a little long. I'm going to try to be fast, and I'm not going to show any pictures. So if you're like queasy, don't worry, no pictures, you won't see anything. You'll see my hand wrapped like this, but that is literally it. So if you are like, I don't want to see anything, you're not going to see anything. So where do I even begin? I'm a week and 3 days post-op as of the day I'm filming this. So things are going okay. Today's the first day. My hand is still let me mute that because that's a lot. My hand is still incredibly sore. I have a lot of restrictions, but I don't feel super ill today, so I decided to film. I decided to get things going because I've been sick literally the entire last week, and today was the first day really that I haven't felt like absolute shit. So I just wanted to, I felt good enough to film and whatnot. So let me look at my calendar. I'll have dates going on. So Sunday, June 6th is the day, I guess, of my accident, if you want to call it that. It's an incident. As most of you guys know, I work in the veterinary field, and I was mixing a vaccine that I've done hundreds of times. Like, this injury is just, it's the dumbest way I've ever been injured, and that frustrates me to no end. And it's literally something that every single person who works around anything has ever done. Like, it's just something so simple. So I was mixing a Bordetella vaccine, which is kennel cough. It's an oral vaccine where I work, and the needle popped off the syringe as I was, you know, mixing it on my hand like this, and it poked my finger. It actually poked me on obviously my left hand, but right here on the little bendy part, my knuckle. And like literally it was just like a little poke. I didn't even bleed. I just picked out the needle head, I put it in the sharps container, I wiped my finger with, you know, alcohol wipe that I had on the table, and I just continued working because I didn't even bleed. Like, it didn't even hurt. Like, obviously I knew I poked myself, but that was just kind of whatnot. I continued, you know, being around cats and dogs all day. I just kind of went through everything, and I poked myself between 12:30 and 1 o'clock p.m. You know, that's the time frame. Well, I got home at like 5:30-ish, and my finger was really sore, and it was a little swollen, like just teeny tiny bit swollen. So I was like, okay, like I poked myself with the needle, like, you know, whatnot. Between 5:30 and 7:30, so 2 hours, my finger had swelled 4 times its usual size. And it was stuck. I can't even do the actual position with my right hand, but it was like bent like this, but at like a 90-degree angle, and like backwards. Like, it was really weird. It was really swollen. It was really red. It was just like a really weird position, like basically like this, and I couldn't move it like at all. So I'm literally in tears because I'm trying to force, with my right hand, I'm trying to force my ring finger backwards, and I can't do it. Like, it hurts so bad. I'm getting pains all the way up my arm, like all the way to my elbow. And so Caitlin decides to take me to the emergency room because she's like, there's something wrong with your hand. Like, you should have had it looked at work. And I was like, well, you know, I didn't even bleed. Like, everybody pokes themselves with needles. Like, it's just part of the job. Like, that just happens. And I am level 1 in the emergency room when I arrive, which means I don't really have a whole lot of priority. I'm not bleeding, I'm not having a heart attack, I'm not in, you know, distress. I mean, I'm clearly upset, but so I'm just kind of sitting there waiting my turn, and I go back at like 8:30, so it takes them about an hour to get me back, and I'm seen by a physician's assistant first, and I won't say their names because, you know, privacy reasons, but I'm seen by a physician's assistant first, and she tells me that it's Flexor. She thinks it's Flexor Tenosynovitis. I don't know if I'm pronouncing that right at all. And basically tells me that I might need potential surgery. I had never had surgery before, so at this point I freak out. Like, I freak out. Like, I'm literally like panicking at this point. I'm like, how? Like, what is going on? And so she tells me that she's going to do some testing, obviously first, to confirm that this is indeed what I have and that I need to have surgery because maybe it'll go away on its own. I think she was just telling me that because I literally was having like, I was having a lot of problems. So let me go back to the hospital visit. Okay, so she orders x-rays and an ultrasound on my finger. They come in, they do the x-rays on my finger, and I'm trying so hard to straighten my hand, like straighten my finger, and I can't do it. Like, I'm literally in tears. Like, I'm crying. I can't do it. They take multiple x-rays. They're not really able to get a good view because all my fingers are like stacked on top of each other like this because I can't move my ring finger. And then she comes in and she does the ultrasound to see what, like, if there's fluid. So the good news was that no part of the needle broke off into my skin, which I think was one of their concerns, which is why they did the x-rays. The bad news is my tendon sheath was filled with fluid, which if you're in any type of medical situation, you should know that that's very bad. So she tells me, like, we're gonna do surgery, and like, you have to have surgery. It's like 1 o'clock in the morning at this point, so now it's June 7th, it's Monday, but like Sunday. I'm then seen by an orthopedic specialist who comes in and basically tells me that indeed I will need surgery. So they do put an IV in, they take my blood 2 or 3 times, I can't remember, and then they start my first round of IV antibiotics, and let's see if I have what they're called. Oh, I have no idea. Then they're giving me, they gave me something for my nausea because I got so anxious. I have really bad anxiety, and when I get anxious, I get really, really nauseous. I got so nauseous. She had me lay down because, like, literally I was about to puke. So they gave me something for that, and then when they told me I was gonna have surgery, I freaked out. Hey, why are you playing so rough? Be nice. I literally freaked out, and so they gave me something to calm me down because, like, I was freaking out. Like, my blood pressure was through the roof. Like, I was actually terrified. So at like 2:30 in the morning, they come over to me and they tell me, like, hey, we're actually going to discharge you. We're going to send you to a hand specialist in the morning. Like, we're gonna have them call you so, like, you can go home, because from my understanding, the surgery that I needed, the ER didn't do. So I had to have a hand surgeon, and it was like 2:30 in the morning. So I guess keeping me overnight wasn't worth the resources that the hospital had because they were very busy, which I completely understand. So they were like, okay, we'll send her home, and then we'll have the hand surgeon, hand specialist office call her first thing in the morning. And then if they do decide she needs surgery, she can just come back. So they discharge me. I get home at like 2:30 in the morning. My hand is literally throbbing in pain. So I go to sleep. I wake up, obviously it's June 7th, and I'm not even awake 15 minutes, and the hand specialist office calls me, and they're like, hey, can you be here at 10:15? I live relatively close, so I was like, okay, I can be there at 10:15, but like, I don't know if I'll actually be there at 10:15. So I literally had to get up out of bed. They told me not to eat, not to drink, not even to take my morning meds, like just come into their office. So I was like, okay. So I went into their office, and obviously my hand is still swollen, like literally nothing has changed because I didn't have anything done. The hand specialist looks at me and she's like, oh yeah, you have 4 out of 4, you know, I think she said naval signs of Flexor Tenosynovitis, like, or however the hell you pronounce it, Flexor something. You need surgery, like, today. Like, there was no option on if I was going to have surgery. It was I was having surgery because, one, there was clearly an infection in my hand. My blood work came back that my white blood cells were through the roof, which was obviously a sign of infection. The redness, the swelling, obviously also a sign of infection. And your fingers are very fluid. The tendon basically allows it to move and whatnot. I had a risk, if I didn't have surgery, of 1, getting sepsis, and 2, losing movement in my finger and my hand entirely. With surgery, I was also told that my hand may never be the same. Like, the finger may never be the same, the movement in the hand may never be the same. You don't know the outcome of things like that. So I was, again, freaking out. Like, I was really, I was scared, to be honest. I'd never had surgery before, and to be told that I needed emergency surgery to fix my hand, like, that day, like within an hour, it was a lot to process at one time. Because, like, I went from being totally fine, and in the span of not even 24 hours, like, they're operating on my hand to fix it. Like, so it was a lot. And so I left the hand specialist office, and between the time when I left her office and the time when I had to be in the surgery center for surgery, I had 45 minutes. So I had surgery. I had to be at the surgery center at 12:15 to be prepped. Again, I can't eat or drink anything. So I get there at 12:15. I have to fill out a ton of paperwork. And because I wasn't a planned surgery, the receptionist is like scrambling to find all my paperwork, because obviously all the surgeries are planned, but I wasn't. So they had to find a hand surgeon. They had to, you know, find an anesthesiologist who was able to do this like emergency surgery, essentially. So I'm really patient. I'm also really terrified. Again, I've never had surgery. I've never stayed overnight in a hospital. I've literally, like, this, every part of this is new. So I'm like terrified. I'm a really anxious person, like I said, and new things just stress me out entirely. And then being told that my hand may never be the same freaked me out. So I go into surgery at 2:15, like actually into the operating room. They obviously did another IV. I have 2 lovely bruises on my arms from my 2 IVs. You see them? They're actually healing quite well, so they're not as bad today as they have been. When they put the IV in again, they started another round of antibiotics. This is now the 3rd antibiotic I've been on in under 24 hours. So that's lovely. And they obviously do, you know, the bag of saline, the anesthesia, like all of that stuff, because I was like fully under for the surgery and I was freaking out, obviously. So 2:15, surgery comes around. They take me into the OR and whatnot. I wake up in the recovery room, and I was expecting myself to be a little out of it when I woke up from surgery, especially with how anxious I was, and I didn't get any sleep the night before, and like I was just really worked up. I woke up and I was like 100%. Like I was like, all right, like cool, like what's going on? Like I was fully aware of everything. And the nurses were talking to me. They asked if I wanted anything to drink, and they were like, you know, we have Sprite, we have Coke, we have blah, blah, blah. And I was like, oh, I'll have a Sprite. And then she asked if I wanted peanut butter crackers, and I was like, hell yeah, I want peanut butter crackers. Like, I'm starving. I haven't eaten anything in over 24 hours. Like, I'm hungry. So, yeah, like I wake up and I'm perfectly fine. Like, I was not dizzy. I wasn't drowsy. They did give me something for nausea prior to surgery in my IV, because I told them that I was really worried about being sick, because I do have a tendency to get car sick. So they, you know, gave me something for that. So I think that helped with the nausea aspect of it. So I'm awake, and they tell me that my surgeon had to make 2 incisions on my hand, which prior to surgery, obviously I met with the surgeon and she told me like, I might have to make 1 or 2 incisions, definitely 1, but I might have to make 2, because I might have to flush out the whole tendon. It just kind of depends on when I get in there and, you know, what things look like. And I was like, okay, that makes sense. Like, you can't say what my hand's gonna look like just by looking at it. Like, so she had to cut the tip of my ring finger, like right here, and then she cut right here on my palm, like right here, and this cut is about 1 inch long and about 4 inches deep, because these two cuts are actually connected where they had to flush everything out. So like it goes down and up into my hand. So like basically this whole finger is like a wound right now, hence the bandage. So they actually did put 1 stitch on the tip of my finger just to keep things closed, but they left this one open on purpose so it can drain, because obviously there was a lot of bacteria there and you don't want to trap bacteria, because that defeats the whole purpose of flushing it out. And they told me they took a swab during surgery to see what bacteria it was, see if they could get it to grow, see what was going on, make sure they had me on the right antibiotics, like whatnot. So I wake up from surgery and Caitlin's there and my mama's there, and I'm literally in tears. My hand hurts so bad. Your tendons are all connected, and they run from the tip of your fingers all the way down to your elbow, and my whole arm was just throbbing. Like I was in a whole lot of pain, so I'm crying. I tell the nurse, like, hey, I'm in a lot of pain, like my hand hurts, I just feel it throbbing, like I'm really uncomfortable. She brings me this massive tablet to take. I don't even know what it was. She told me, but truthfully I was so upset I don't remember. And I'm eating my crackers, I'm drinking my Sprite and whatnot. I am discharged that same day with instructions to not unwrap my hand until Tuesday, which is the 8th. So I go home. I'm on 2 oral antibiotics after being on the 3 antibiotics at the hospital. I'm on 2 oral ones now, and I'm on a narcotic pain medicine, and I have to alternate between the narcotic and ibuprofen basically for the next week, potentially longer. And the hospital had already scheduled my post follow-up surgery, my post-op surgery appointment, and then my occupational therapist meeting. I had no say in that. They had that entirely scheduled. They gave me a piece of paper and they were like, hey, be here at this time. And I was like, okay, cool. So Tuesday comes around and I'm instructed to take the wrapping off of my hand. There is iodine foam, iodine little strips that I have to actually pack into my hand, like in my hand, to keep it from closing, to make sure that when it is, you know, draining, it's coming out, it's not just sticking in there, because that's obviously not very good. And I'm having to soak my hand in warm soapy water and basically just try to move it, 1, to flush out any more bacteria, and to 2, just keep that joint from hopefully locking up. 3 times a day, 3 to 4 times a day. I did 3. So basically I did that on Tuesday. When I first see my hand after surgery for the first time, I'm in tears. 1, it's extremely painful, and 2, it's like, it's a really big shock for me, because literally a day before my hand was perfectly fine. Like it didn't hurt. I was able to, you know, move my fingers. I was able to do whatever I wanted. And then now I'm like, literally, I can't use my left hand at all. Like they told me you are not allowed to use your left hand at all for the next, at least the next week. And I had to be obviously really careful. I have a lot of pets, and they told me they can't keep me away from home, but you know, I have to leave it covered. I have to obviously be very, very careful. I can't really do anything. So that happens. So I go Tuesday, Wednesday, Thursday, you know, soaking my hand, packing my hand, wrapping my hand, all of these things. My antibiotics have made me incredibly sick. I'm pretty sure I didn't get off the couch or like out of bed like all week. Like I was dead to the world. Like I felt like absolute crap all week, and that didn't go away until like today is the first day I haven't felt like crap, and today's Thursday, so like over a week. So Friday was my first meeting with the occupational therapist. So I meet the occupational therapist, and you know, she has me unwrap my hand, and she tells me, you know, like, I'm here to hopefully keep your finger fluid and moving and all of these things. And of course I'm really nervous because I've only done physical therapy once for my back, and occupational therapy is something entirely different. And I was really nervous because, you know, I use my hands obviously for everything. In my line of work, my hands are really important. So I was really freaking out. She comes in, she tells me I need to do exercises over the next several days, and I need to do them every waking hour, and that I have to do occupational therapy with her at least twice a week for the next 3 weeks to keep my finger fluid. So I was clearly upset by this, because, you know, the state of my finger and my hand were very unknown at that time. My hand was not looking great. It was draining a lot, which it's supposed to drain, but it was draining a lot. It had started to bleed actually on Friday, which wasn't normal. My stitch was actually bleeding as well. I was very, very concerned about what was going on in my hand. So this past Tuesday, I had my post-op appointment, and then I also had my next occupational therapy appointment. They were actually back to back. So I first go in and I see the hand specialist. And actually the one that I saw was the nurse practitioner who actually assisted during my surgery, which I really liked because she was there and she kind of knew what was going on and everything. So I see her and she tells me, like, basically they take the stitch out. My fingertip actually didn't close, so it's open now. So now I have 2 open wounds rather than just 1. And it's disgusting. I won't go into detail of what it looks like, but it's pretty nasty. And then she tells me, like, hey, we got the results back from your swab. It's Bordetella bronchsceptia, whatever, I don't know the worm. It's Bordetella, which she was like, it's from a dog. And I was like, it's the vaccine I was mixing. Which is what I suspected anyway. Truthfully, they told me it most likely came from an animal due to how fast it was moving through my body. And basically, from what I understand, I don't know if this is true, but from what I've been told, if Bordetella is injected into humans, it can like eat your flesh. I don't know if that's true, but that's what I was told. So yeah, when I was mixing it, a little bit must have come off the needle and went into my hand or something along those lines. She did tell me, actually all the doctors, specialists, whatever, nurses, all of them told me I was very smart and very lucky to have it looked at as early as I did, because it gives me a higher chance of recovery, like a higher probability of not having my joint lock up and not having all of these other problems that I could still potentially have, but not, my chance of them are a little bit lower. So that's nice. And the blood work did come back. It did not enter my bloodstream, which is also very good news. So yeah, they told me on Tuesday that they wanted me to stop packing my hand with iodine. They wanted me to let it just close on its own. But now I have to be extremely careful. Like, I'm not really allowed to do anything. I mentioned this in my SpongeBob video. I'm not allowed to hold anything that weighs more than a pound with my left hand. And everything weighs at least a pound. So it's like impossible, and I'm not allowed to do lifting, pushing, shoving, pulling, any type of activity with my left hand that, I guess they described it as being hard. I can now like pull my hair up. It hurts, but I have to keep using the finger to the best of my ability. And I also have exercises now that I have to do at home to hopefully help prevent scar tissue from forming in my tendon, because it's very bad if that happens, which could potentially lock up my finger. The occupational therapist also told me that, like, she gave me the exercises to do, and told me that, you know, I just need to keep exercising it. I need to wash it. I have these little finger compression things that I have to wear on my ring finger to help with swelling, and I have to like massage it up and down, and it hurts when I do this. My whole hand actually hurts, like down to my wrist. Like it's really sore. And then I have this little guy. This is actually just like a sleeve that I only wear around the house. I have a full glove that I have to wear if I'm out. I have to sleep in the glove as well. It literally is like this, but like glove form, and I have to wear this and the glove at the same time because there's so much swelling in here. They're obviously trying to get that down. I obviously have to keep it covered and packed, and that covered and packed, but this is my compression sleeve. It's to help with the swelling up here. Truthfully, I prefer the glove, but when I'm like filming and stuff, it's a little bit easier to have my other fingers exposed to like touch things and stuff. My ring finger, I can't straighten it, as you can see, and I can't really bend it all that well either. It's in a lot of pain, but yeah, that's what happened. Like I said, my medication made me very, very sick, and I'm very, very happy that I'm not sick anymore. Yeah, it was really scary. It was a really scary experience, and you know, I'm definitely not out of the woods yet, because obviously the state of my finger is currently unknown. I am following doctor's orders and doctor's advice and everything to hopefully get my movement to as normal as possible, as quickly as possible. I'm obviously kept off work, which I absolutely hate. I love my job, and being home is not really, it's not really my strong suit. I get really bored, and so I don't really know what to do with myself. Like, I've already cleaned my apartment with my one good hand, and I've already done my homework, and I've already filmed. This is my second video filming today, and today's just the first day that I haven't felt sick. So like, I did a little bit of stuff yesterday for school, but like, I did all of that today, like all of that today. So I don't know what I'm gonna do with myself, but yeah, I'm basically kept at home pretty much entirely. Like, I can go out, but I have to be really careful. They told me I have to be really, really careful. I can't go in areas that have a high population of animals, so I can't take Olive to the dog park. I can't go to pet stores. I can't do any of that because animals carry a lot of bacteria, and because I have now 2 open wounds on my hand, they don't want to introduce any new bacteria or, you know, possibility of something happening. So I've been instructed to stay clear of those places. They did tell me I could go to the zoo because I'm not in close proximity to animals, and they're obviously kept behind barriers, and I can do that with my hand wrapped very securely, is what she said. So I just have to be smart about it and be careful, obviously, because I do have 2 open wounds on my hand. I'm instructed now to just wash my hands with soap and water and clean out the wounds diligently and keep them covered, let them heal on their own, and continue draining, because they're still draining, and it's disgusting. The color is nasty. Everything is just disgusting. It's so nasty. It hurts a lot. Yeah, they told me Tuesday to stop taking my narcotic, so I'm taking ibuprofen now, which also helps with swelling, but not so much with pain. Tylenol has seemed to help a little bit. I still have some of the narcotic. They told me to stop taking it. Yeah, I still have it. I might ask tomorrow, because I see my occupational therapist tomorrow, if I should just take it like when things are really, really bad, or if I should just not take it at all, because they weren't really specific. They just said like stop taking it, so I don't know if that meant like at all, but I haven't taken it since Tuesday. I actually haven't taken it since Monday, I think, because I waited because of Tuesday's appointment. What else? I'm not allowed to type with my left hand, which sucks. I mean, I can type with my index finger, but like that's it. So typing homework is ungodly slow, and I'm a really fast typer, so that's punishment for me. I was cleared to drive on Tuesday, which I love to drive, and I wasn't allowed to drive for over a week, so I was pretty upset by that. But I was cleared to drive again, as long as I'm smart with it, as long as I obviously am not being stupid and, you know, doing things I shouldn't be doing. Yeah, can't do anything with my left hand, can't lift anything over a pound. What else? I've been kept off work, which, like I said, it doesn't really sit right with me. I do understand where the like where the doctors are coming from though, because it was not just one doctor who made that decision. It was 3 different medical professionals that came to that decision. So I do understand where it's coming from, because obviously I personally don't think my body could handle another round of antibiotics, because I was on so many in such a short period of time. My narcotic made me incredibly dizzy and woozy and forgetful and everything. So I understand like where they're coming from, because physically I don't think my body can handle that, and I obviously I have a high possibility of catching another infection with 2 open wounds. So I do understand that. I'm just gonna be really bored, because I like to work, and it's something that I obviously do. So being at home is not really something that I'm very good at. Let's see what else. I feel like there was something else I needed to tell you guys. Thank you guys for sweet messages. I've read, I think, all of them. Your questions about how my hand's doing, what the doctors have said. It's been really, really nice to see exactly who's concerned and who isn't, if you follow my drift. It's been really nice to see who's concerned, and like to see your sweet messages and your get well soon wishes, and your tips on different things for discomfort, because I still have to sleep out with my hand elevated to reduce pain and swelling, which sleeping like this is so unnatural to me. So I haven't really been getting a whole lot of sleep, even though I've been sleeping all the time. Like, I feel like it's not very good quality sleep, if that makes sense. Yeah, I also thank you guys for just being really patient with me. I was gonna upload last week, and obviously I wasn't able because I was super sick. Just thank you guys. So if you guys see my hand wrapped in my sleeve or my glove in my next upcoming videos, that is what's going on. I was cleared to take a shower by myself, which is amazing, because last week Caitlin had to help me wash my hair in the bathtub. Like, literally I just like dunked my head over the tub, you know, and she had to wash my hair because I couldn't use my left hand at all. I was cleared to shower on my own. I just can't obviously use my hand to wash my hair or use body wash or anything like that. So I have to just be smart about things. But yeah, I can't sweep with a broom yet. I can't do that twisting motion, it hurts. And I can't do the dishes. Like, I can load the dishwasher with my right hand, but I can't like wash dishes. So yeah, that's kind of where I'm at right now. Obviously I don't really know a whole lot more. I've literally told you guys basically everything that I know at this point. No, I think I did tell you everything that I know at this point. It's kind of like a waiting game as to see what my body does and how my hand progresses. I'm hoping it's progresses and not you know, degresses. Like, that would be terrible. But I'm following doctor's orders, I'm following doctor's advice, I'm following their exercises to literally a T. Like, I'm doing it all the time. They told me to leave my hand out like this so I could use it a little bit more, which I've been doing. I've been trying anyway. My ring finger doesn't really want to be a team player, so I do have a Velcro strip that they gave me where I have to like basically rubber band my ring finger to my middle finger, so it is forced to be a team player, because my ring finger is like, no, I don't want to do it with you. But obviously that's not how it's supposed to be. They're supposed to move together, and they are not wanting to move together. So that's kind of like where I'm at right now. I get really sharp, intense pains in the palm of my hand that shoot up my finger and then down my elbow, quite frequently actually, which is, I guess, normal, because the tendon was obviously disturbed and infected. So yeah, that is what happened. Literally in the span of just a few hours, my finger was considered an emergency, and it was very scary. This past week has been really scary, very painful. A lot of information to go over. I've seen, let's see, I saw the physician's assistant in the ER, I saw the orthopedic specialist in the ER, I saw the doctor in the ER, I saw the hand specialist, then I saw my surgeon, then I've seen the occupational therapist, and I've seen the nurse practitioner. I've seen 7 just like doctor, nurse practitioner, or occupational therapist in the last week who are like specifically dealing with me, not to mention all the nurses that I had a ton of great nurses, especially in the surgery center. They were just so sweet. I felt like a big baby because I was freaking out. It was my first surgery. I actually called my boss crying because I was freaking out. Like, I'd never had surgery before. And they were all just super sweet. And yeah, they were really, really nice. And they were great. And I really liked them. I really did. They did a great job. And I really lucked out with my surgeon and my nurse practitioner and my occupational therapist. They are all lovely people. And yeah, I think they've really made a negative experience be a little bit more positive, you know. Like, obviously this wasn't something that was great for me, but they really helped be really nice and really understanding and really sweet, and I really appreciate that. So that is really it. I think that's everything. So if you have any questions about anything that I didn't answer, just leave them down below or message me. Instagram, Facebook, Twitter, even Snapchat. I don't really use Snapchat, but you could do that. Any of those places. Yeah, that's kind of like where I'm at. So I will definitely update you guys as my recovery happens. I do have, obviously I have occupational therapy tomorrow AM, and then I have it next week twice, and then I have it the week after that twice, and then I have another post-op follow-up appointment the week after. So basically the next like 2.5, 3 weeks are like pretty I guess critical to see exactly where my finger and my hand are at. So I will definitely keep you guys updated, maybe in a Instagram post, maybe in an Instagram story. I don't think I'll make a whole nother video because I don't think we'll have that much to talk about. But yeah, make sure you subscribe to my channel before you leave. Help me reach my goal of 1,000 subscribers. Give this video a big thumbs up, and I'll see you in my next video. My goodness, I'm really hungry. I'm like really hungry. I might go to Panera Bread. That sounds fantastic. Doesn't that sound good?